horse health check. We have different levels of assessing health in our horses. We have the ADR method, we have the EDPP method, we have the TPR method, and we have the HHC method. So I'm going to challenge you to move up a level because the ADR method stands for ain't doing right. So you go out to the barn and you look at your horse and go, yeah, he just ain't doing right. Not sure what's going on. So that's kind of an important thing for us to be able to pick out for our horses, but I'd like to challenge you to go up to a couple other higher levels. So the next level is EDPP. Anyone know what that stands for? E is for eating, D is for P is for pooping. Pooping and peeing, okay? So we all know if your horse is not eating, drinking, peeing, or pooping, if you don't have a problem now, you soon will. All right? So that's the other thing that you want to look at when you're walking into the stall. Is he eating? Is he drinking? Is there wet spots in the stall? Is he pooping? Is it normal? You know, if normally you come in and there's 2 wet spots in the stall every morning, and today you come in and there's none, you're going to get worried? You should, right? Same thing with poop. We spend a lot of time looking at poop in horses. If you're a new parent, you know this from your babies, all right? So you take a huge interest in their toilet habits. And we should with our horses because essentially their bedroom is their bathroom. So when you walk in the morning, eating, drinking, peeing, or pooping, we have to take a look at that. All right, but that's a nice thing that we should look at, but I want to encourage you to go up another level, which is TPR. Now, anybody in 4-H or Pony Club, if you don't get this one right, I'm just going to give you 50 lashes with a wet noodle. So TPR stands for? Excellent, temperature, pulse, and respiration. So those are all really good as well, but they don't always give you a lot of information. We can still have something going on with our horse and have relatively normal temperature, pulse, and respiration. All right, they can be in normal ranges. So what I want to do is encourage you to just move up one level, which is the horse health check. Horse health check is a tool for you as a horse owner. It does not diagnose, but it does alert you to things that are not normal. Ideally, it would be done every day on every horse. Do I do that every day on every horse? Absolutely not. But if I walk out there and the horse ain't doing right, now I go to the next level, which is the horse health check. All right, so we're going to go through this and take a look. All right, so there's a couple of ways that you should look. First of all, take a look at the horse at rest. All right, what's the horse's general condition and attitude? So is he bright looking around? Is the horse overweight, underweight? Is the hair coat sleek or dull? Is the horse alert? Is he lethargic? And then go into the rest of the horse health check parameters. The other part of this is seeing the horse when he's moving, because we sometimes don't see things when the horse is standing there quietly. So we get the horse out to trot back and forth. So we go out and back, get the horse moving. You can see their attitude, and that gives you a better assessment of what's going on. This is what we call a digital learning object. We use this in some of our courses, our online courses. So you can actually work through this yourself and go back and review things. But I'm just going to go through each one of these directly. So we start with the eyes. So you'll notice first thing there, I have green, I have yellow, and I have red. The obvious question, green means, yellow means, careful. Red obviously is the bell ringer, call the vet, stop what you're doing, all right? The horse is a prey animal. That means it lives through its eyes, its ears, and its nose to detect predators. If at any time you see that horse with a glazed look, there's a problem, because they are hardwired to keep looking around. How many times do you see that in horses? All right, they graze a little bit, they look around. Even in pastures with their pasture mates and their, with their buddies, and they're not feeling afraid, this is instinctive behavior for them to look around. All right, so if you ever see your horse and he's just kind of got that deer in the headlight glazed look, that's a problem. So glassy-eyed would be a problem. A fixed stare or a sunken eye. So on the horse, right above the eyeball, there's that funny little indentation. That goes in more so when that horse is sick. So you see that sunken eye, the eye looks very, very different. Those are all warning signs that there's a problem. The other thing is mucous membranes. Now, if you know the person next to you, you might be able to do this with them. Ask them to lift up their lip. Take a look at the mucous membranes, and the mucous membranes are the tissue that are above your teeth. They should be pink. They should be moist. All right, so we talk about them being salmon pink, that salmon pink color. If that is pale, so it's more of a whitish, a very, very pale color, or if it's tacky. So instead of taking your finger and being able to run it across the gums very easily, it's kind of sticky as you're doing that. That's a warning sign. All right, so it could be a bunch of different things. It might be dehydration, it could be other things. So again, the point is not to diagnose it, it's to be aware that this is not normal for your horse. If you ever see it dry, if you see it purple, if you see it red, or you see a blue line along the teeth, those are all red bell warning signs, and you need to talk to the vet to find out what's going on. So those are all things to pay attention to. All right, cap refill. Now everybody has to participate. Hold your thumb out. Take your thumb and forefinger on your other one, look at your thumbnail. If you've recently painted your nails, you don't get to do this one. All right, so I want you to press on your thumbnail, watch what happens to the color, then let go, watch what happens to the color. What'd you see? Right, so it went white when we press on the thumbnail, so that's what we call blanching, and then when we release it, it should come right back. Anyone take a bit of time? Oh, okay. See, now that's not normal. All right, so if you're able to do that and you take your finger off and you count 1,001 and it's back, good to go, carry on. But if you're sitting there going 1,002, 1,003, and it's just slowly coming back, there could be an issue there, right? If you press it and it doesn't come back, well, don't worry. All right, so, yeah, zombie time. Now, who's had a cast on their leg? No one here? Come on, you're horse people. Yes, you've had, okay, did you ever have the doctor press your toenails when you had the cast on? Okay, sometimes if you go into the doctor, you've got a cast on your wrist or on your leg, all right? The doctor will squeeze your toenails or your fingers. And what they're doing is the same thing. They're seeing if you've got good capillary refill in that limb. And believe it or not, that simple little test tells you what the heart's doing, right? In an indirect way. It just tells you, are you getting enough volume going through? So if the heart's beating properly, we've got lots of volume flowing through the horse's veins and arteries, then you'll see that capillary refill come back very, very quickly. If it's delayed, that indicates a problem. Okay, jug refill. Probably not one you need to use very often. We teach the endurance riders to do this as another test, and it's part of the horse health check when we're assessing eventing or endurance horses. And essentially, we're doing the same sort of thing, taking a look at the cardiovascular system as a quick test. It gets more difficult in the winter when the winter coats are coming, and it's virtually impossible on the Thelwell fat little ponies. If you've got a lean horse, that's the jugular vein. All right, we each have one. So if you put your, turn your head to the side and you'll feel a little V down the side, a groove. Right? That groove is where your jugular vein sits. So that's essentially what we're looking for on the horse. So the test is you run your thumb down and you empty it out, but then you press, and you're testing how long it takes for the blood from the head to fill it back up. All right, so when you see my finger go up, that's how quickly the blood's filling back up. All right, and on endurance horses, eventing horses, horses that have either the dehydration or fatigue, other issues, you'll see it's very, very slow filling back up. So again, it's another little test that you can learn to do on your horse once you know what's normal. All right, everybody has to work with me again. Put your hand out, thumb and forefinger. You're going to pick up a little bit of skin off the back of your hand. You're going to pull it up into a little tent. Isn't that cute? You're going to twist it just a little bit and then let go. What happened? It stayed? Okay, we have a problem there. Just pull it right up and let go. There, okay, perfect. See, you're fine. All right, whew. All right, So when you pull that up, it should snap back, right? And on the horse, you'll notice where I'm doing it is on the front of the shoulder. You may see vets do it on the side of the neck, and you may see it on the eyelid. But generally speaking, for horse owners, it's a nice little test that you can do. It gets used a lot in endurance, eventing, that sort of thing, just to pick up what kind of dehydration is there. All right, now, just like if I did this with everybody in here, we'd all have a slightly different response because age and skin thickness and fat thickness underneath has that impact. So you need to know what's normal for your horse at home so that when you go out and you're on a trail ride on a sunny day, or you know the horse has been in the trailer a long period of time, you know what's normal for your horse and you can pick that up very quickly. Heart rate. Everybody know what this is? Should I award the good ones or mark out the bad ones? Who has one of these in your barn? Excellent. Okay, your homework for those who don't have one is get one. Talk to your veterinarian or go to the pharmacy, all right, and pick up a stethoscope because you're going to learn that it has real importance for you. Now, if you're a doctor, the rule is you have to keep this in the freezer so that when it touches you, all right, fortunately, horses aren't affected by that. So a couple of things about the stethoscope. This is the part that we're going to put on the chest wall of the horse. And these are the ear pieces. When you put them in, here's a really important thing. Don't let this swing. All right, because you can actually damage your ears when it hits your belt buckle. All right, so put it in your ears and then drop your head forward so that these sit right into the ear canal. And what we have found is lots of people have ear canals that aren't exactly the same. So you may have to find the sweet spot, all right? And there's different types of stethoscopes. You can get the soft ones, you can get the hard ones, there's different things. But put it in your ears and find the right spot so you can hear the best, right? And then you're going to take this flat part and find the elbow of the horse and put this up in behind the elbow on the rib cage. And again, every horse, depending on their conformation, may have a slightly different spot where it's perfect for you to get the best sound. So when you're doing it on your horse the first time, move it around, go up, down, make a cross, right? I'm not actually doing that, but on the horse, just so that you can find the exact spot for your horse. Because some of them have a little hollow, others are fat, others have more muscle. Your slab-sided horses are a lot easier to find. Again, those fat little Thelwell ponies are really hard to find. Learn how to do this on your horse so that you can quickly pick up that stethoscope and listen. And what you're going to do is listen for the heartbeat. And the heartbeat is 2 sounds, okay? Lub-dub, lub-dub, lub-dub. And don't get into the habit of counting 1, 2, 3, 4, 5, 6. I was at an endurance ride and this horse had a heart rate of 120 and he's standing there quietly, not panting. So when I listened at the same time that this person that was in training, she was doing that. She's going 1, 2, 3, 4, 5, 6. And I'm going, okay, let's take a step back. So a lub-dub is 1. All right, and the best way is to put it on, and the very first one is a 0. Start your watch if you've got a second hand or your phone. All right, this is the one time we'll let you use your phone when you're near your horse. All right, is for 15 seconds. And so you press start when you hear that first lub-dub, and then you count for 15 seconds, multiply that by 4. So that's a consistent way to always get the same amount. Because otherwise, if you're counting the first one or you're starting the watch in between, sometimes you'll get, you know, a plus or minus 4, obviously, will be the difference there. So multiply that by 4. 25 to 40 beats per minute is a resting heart rate of a horse. What's yours? See, you don't even know your own. 68, 60? Okay. If you're a good athlete, it could be lower. If you're a couch potato, it's going to be higher. All right, so anywhere from 60 to 80 in humans. All right, really good athletes, it'll be much lower. So know what it is for your horse when it's standing there, right? It's also kind of fun to have the stethoscope on your horse when the vet walks in the door, too. All right, you'll see a lot of things. So the heart rate is a very valuable tool to look at your horse and assess what he's doing, but understand that emotionally, that horse, it may be affected. So if you get some weird result, just take a step back, let the horse relax, and go back in and do it again. All right, it's really, really easy. So it should be 25 to 40. If it's under 68, when you bring your horse back from a ride or on a trail ride, all right, in 10 minutes, that's good. All right, if that heart rate is staying up 68 or higher 10 to 30 minutes after the exercise, then that's a horse that's been stressed, is exercised harder than normal. It's just not recovering as well. But if that's a horse that's standing in a stall and it's got a 60 or 68, right, that's a problem. And then if it's over 68 in 30 minutes or stays 68 even though you've been moving around and the horse is standing there quietly, those are red signs, right? So be careful with that. Now there's a rule of thumb, and I do stress it's a rule of thumb because it isn't always predictable, and our vets will tell you that too. But horses with a, they talk about the 40, 60, 80 guideline. So if it's 40 or lower when the horse is standing there, that's probably a horse that's okay, all right, probably, all right. If it's 60, there's likely to be a problem going on there, and if it's 80, then we've got some real problems, all right. So like I said, very, very rough guideline there. All right, so you're going to be practicing doing that stethoscope thing. The other thing that you're going to do is with your stethoscope is listen to gut sounds. I always bring my toys. This is a human digestive tract. So the yellow represents the small intestine, and we call it small intestine. It's obviously the longest one, but we call it a small intestine because of the diameter. This little blue thing, anybody know what that is? Very good. Okay, it's about the size of your finger and sits right down in here. And then this is our large intestine. All right, so that's all scrunched up and put into you. All right, so in the horse, however, now everybody has to help me. I want you to pass that around. Keep going, keep going, keep going, keep going. Keep going, keep going. Oops, there's colic. Not a good sign. Well, there's another.
Oh dear.
Oh
my God. Head's lost. Your audience are taking it away from us.
Yeah, yeah.
It's going around and around and around.
Yeah, pass that red end down. Okay. So, yellow is the small intestine of the horse. Instead of an appendix, we have a, what are you holding? Starts with a C. Cecum, exactly. And then we've got the red one wrapped all the way around his neck. You're holding on to the business end where the poop comes out. I didn't do it to you guys. Normally I have signs that I give to everybody and they go, I am the small intestine. I am the cecum. I am the large intestine. And you know which one you would have had? I am the anus. So I did not give that to you. All right. So the problem we've got with a horse is all fiber trying to get through this huge long tube, right, and all the way out the other end. So everybody knows at about 11 o'clock, 11:30, you hear your stomach growling, telling you it's time for lunch, or maybe it's growling now, in which case we have muffins over there. But what you can do is listen to those gut sounds with your stethoscope. And so what you should be listening for are bubbles and gurgles, or think about water running through a brook, that kind of sound. So those bubbles and gurgles, right, are things that you should be listening for. And they sound just like yours. So you can practice on your dog. You can do this on your horses. You can listen to yourself. All right, and the whole point is if you're hearing bubbles and gurgles, then that is reflecting food going through there. If everything stops going through there, what happens? Yeah, we have major, major problems because that horse isn't going to be pooping. And if we haven't got a horse that's pooping, we got stuff collecting in there, gas and impaction and all the rest of it. So you can listen to your horse's gut sounds through your stethoscope, right? And you should hear normal sounds. So this is why you have to do this on your horse to find out what sounds normal in your animal. And roughly, and I stress this, roughly every 6 to 10 seconds, you should hear some bubbles or gurgles. And what we do is we listen to the gut sounds on the top quadrant, what we call that, and then you move it down and you listen to the bottom. If you're doing that, make sure your horse is okay with you doing that. I've been cow-kicked by a horse that didn't want to be touched down there, so just make sure that you've done that with your horse and he's okay with it before you put this on it. And so you're listening for those bubbles and gurgles for normal sounds. If you've just fed your horse, obviously those sounds are going to be a little higher. If you haven't, if that horse hasn't eaten for a while, they're going to be a little quieter. But in a normal situation, you need to know what's normal, because if they're reduced and you're not hearing, you put your stethoscope on and you're listening and listening and listening, all right, that can indicate a problem. Or if you hear nothing but bubbles and gurgles and it's just constantly rolling through, all right, that can indicate a problem as well. So if they're absent or abnormal sounds, that's a problem. And by abnormal sounds, I want you to close your eyes and think about water dripping in a cave. So bloop, bloop, that kind of sound, all right, because sometimes that can indicate that we've got a pocket of gas or other weird and wonderful things happening in the gut. So if it's an abnormal sound, you need to be aware of that. All right, respiratory rate. So you can do this a couple of different ways. You can actually use your stethoscope and listen on the trachea, or the easy thing is just to step back and watch the flank movement of the horse. All right, and so you're looking for a nice even rhythm of the horse breathing out and then back in, and then out and then back in. If you see it panting, so horses will actually pant, they don't open their mouth like a dog does, but you'll see the nostrils flaring. All right, and if you see that, the horse, it needs oxygen, so that's why they're breathing that much more. So they may be overheated and trying to help cool themselves, but if they're blowing like that in other circumstances, then that could indicate a problem as well. So you just need to be aware of that. And if it's labored, so you see that horse really working hard to breathe in or working hard to breathe out, all right, those are all problems, or if it's noisy. So again, that's not normal for a horse, and you need to stop and take a look at that. All right, anyone have a horse with heaves? Okay, so you've seen that when they break into an episode, all right, and they'll actually develop what they call a heave line on their belly because they're working so hard to push that air back out and to get it back in. So you actually see a line develop there from the muscles on the rib cage. All right, so normal breathing you want to see, and we want to see it come back to normal quickly after exercise. Joints and legs. I work with a very good vet that does a lot of work with the Canadian endurance team. His name's Dr. Art King, and he puts a challenge out to all of our team members with this thought. If you were blindfolded and your horse was lined up with 10 others, could you find your horse just by feeling the legs? Do you know your horse's legs so well, all the nooks and crannies and the bumps and everything else, that you could actually pick your own horse out? All right? And so, while that's not necessarily a reasonable thing to ask, it just sort of underscores the point. Really know what it is that you're feeling, to really learn how to negotiate that topographical map of the horse's legs so that you can pick something up. Because one of the worst things when I used to do lay judging for the endurance competitions, and you'd feel the leg, and you're going, how long has he had this? Well, I don't know. Right? So that's not helpful. So you need to know what your horse's legs look like. So obviously, if there's any heat there, these are your best measures of heat. Learn how to very quietly and confidently feel heat on one leg versus another so that you can pick up that heat. Any swelling where it's just a bit softer, right? Notice those so that you know what's going on. Obviously, if there's any pain, the horse flinches or tries to guard the area, or it's raw or it's bleeding, those are areas that are of higher concern. Wounds, saddle, and girth. You need to go over the horse's back, particularly if you've been riding or if the horse has had a fall. One of the things that you can do is just run your hands down the back and then just put some pressure down the back so that you can see whether or not the horse has got a back problem. And what you'll see is these horses will flinch, or they'll pin their ears, or they may even turn and bite you. And that really hurts. So these are just some ways that you as a horse owner can check that out. And it's really good to help you assess saddle fit as well. So if you do it after an hour after you've ridden or the next morning, you can pick up a lot of problems with your horse that way. Sometimes what happens if you get off the horse, pull the saddle, and immediately do it, you may not see those points because they've been numbed. And that's a bit sad when you think about that there's so much pressure, it's numbed it, and then you feel it an hour, or shows it an hour later or the next day. All right, so just another little thing that you can do. There's the muscles and back, so that's what I'm looking there with my fingers. So people say, okay, well, how hard should I press? Because obviously you can inflict pain with pressure. I want you to take your fingers, and I want you to imagine a marshmallow in between your fingers. And you're going to put just enough pressure to compress the marshmallow, but not to put your fingers through it. All right, so you don't have to dig your fingers in, but you're not going to just very, very lightly. You want to put a bit of pressure, and that's going to help elicit a response if there is a painful area there. That really helps. All right, so we don't want it tight and tender. Anal tone. This is always lovely. The anus is actually a round circle of muscle that's at the very end, and its job is to keep the poop in when it shouldn't be pooping. What happens with horses that get exhausted or get into other medical conditions is this ring of muscle starts to relax. So everybody knows if you're grooming a horse, there's a rule that when you get to the tail, the horse has to lift its tail and go, psst. That's like horse language. They all teach it to others. One of the things is if that is not reacting, right, so you'll see how it puckers up. And that shows that's a normal response there. So for horses that are heat stressed or really fatigued or in other health issues, right, it just stays open, it's non-responsive. And why do we do that? Why do we care? Well, because as goes the anus, so goes the rest of the intestinal tract. Right? So the things that impact the physiology of that little muscle can also impact everywhere else through the horse, particularly its digestive tract. So the other thing is you'll see that the penis may be relaxed in male horses. Again, that's something that will happen if they're just totally exhausted. Right? They won't retract when the horse is moving. So those are all things that we don't want to see. Now, rectal temperature. Normally I have my thermometer, but it seems to have disappeared. So you also need to get a rectal thermometer for your horses. Now, do you know the difference between an oral and a rectal thermometer? The taste. All right, so label it. Make sure you do not mix it up with the kids' thermometer in the house. And the nice thing is today you can get the new digital thermometers, which are lovely to work with compared to the old glass ones. The digital ones are great because they give you a little beep when it's cooked long enough, and you can pull it out and really easy to read. All right, so there's your normals. So 37.8 is the rough one. Again, horses are going to be a little bit different. So if I go down the shed row, every horse is going to have slightly different temperatures and slightly different days. All right, so again, learning what's normal. So we talk about, again, those other two green things are for endurance rides or events. So if it's 38.6 pre-ride, 39.6 during an endurance ride, that's okay. But if it starts to get over 39.5, now we've got some problems. And anything over 40 is a problem. And the one thing about rectal temperature is it's usually 2 degrees lower than core temperature. So if that temperature is 41, 42, at the back end, it's higher in the middle of the horse, and that's why we can have damage to the proteins in the animal because they start to denature when you start getting up into those levels. So that's another reason why we want to take a look at rectal temperature. So if this is the anus, right, and it's closed, and this is your thermometer, it has to gently, and lubrication is really important here. So if you don't have a thing of Vaseline in your barn, spit. All right, lubricate it. You gently put it in straight, all right, and then you press it to the side. Because if it's straight through, what's it likely to be sitting in? A poop ball or air, all right, and you're going to get this weird temperature that's really low. So just very, very gently press it against the side, but no poking, just very slowly put that in, gently press it to the side, wait for it to beep, and then slowly withdraw it. Now they say to put the string on, particularly the old style glass ones, all right, because you could lose those. And they have been lost. And when they're glass and full of mercury, that's kind of a bad outcome. So the new ones, they actually widen. So if you're using those and putting them in slowly and hanging on to them, and you don't have to hang on long, all right, so you really shouldn't put a string and walk away. All right, I've seen it. But just hold it, because it's done in like literally in a few seconds. It doesn't take long for those thermistors to pick up the temperature. So just as it starts to flare, right, you can put it in up to that hilt is the way they direct them. So then the last couple of things that we're going to look at is impulsion. So again, horses are made to move. They like to move. So when you see horses that are just like really lethargic and they don't want to move, or you ask them to walk and they just kind of drag their feet, then that's a problem. Stumbling, short-stridedness, all right, those are all warning signs. Stiffness and limping is a big problem for horses, right? There's a lot of undiagnosed lameness issues because we tend not to look at it, or we don't know what to look for. And so sadly, there are horses with various lameness issues. There was a study done in the UK on it, and the numbers on that were really kind of scary, that the number of horse owners that are not picking up lameness in their horses, or talking about them being racing sound. Oh, don't worry, he'll jog out of that. Once we get him going, he's just fine, all right? And as was said, when you've got adrenaline running, those horses will run on a broken leg, right? I have been at the racetrack when a horse has shattered its leg and keeps running, right, because of that adrenaline drive. So it is something that we as horse owners need to learn. So if your vet is there assessing a lameness, or anytime you can take more education on picking up lamenesses, Sue Dyson has a great series of videos talking about lameness in horses. And Sue Dyson is an internationally renowned veterinarian that has done that series. So you can check that and see. Here's a normal horse. So what I want to do is help you train your eye. So you're going to watch that horse trot away from you. You watch the tail, you watch the way the feet are falling, you watch the hips as it's going away, and then again you're watching the head and the ears as it's coming towards you. You're listening for the sound, right? And I'm sorry we don't have speakers on because you could be able to hear the sound. So if you're on a hard surface, it really helps to pick up, because you can hear the clip, clop, if there's something. It should be a nice even rhythm. And then we're going to look at this horse. Is everybody seeing that? Because it's really, really obvious. All right, so you watch that head, especially when it goes by the bricks, see the colors? So you can just see that head bob. All right, so that's one of the things we want you to really, really train your eye to start seeing lameness abnormalities in your horse. All right, so again, I'm not asking you, you'll notice I'm not saying which leg, because that's not the point. All right, you notice a lameness, you know it's not normal, and you talk to your veterinarian about what's going on. Trying to diagnose it yourself can run into all kinds of problems. That horse is severely laminitic in both fronts. So she is limping more on the one that hurts more. All right, so that's the problem with us trying to diagnose lameness when we're not trained on it. So you really need to get your vet involved in that. And last thing, attitude. So this gets back to our ADR level and the EDPP. Are they bright, eating, drinking? Are they depressed or lethargic? That's a problem. If they're dull, not interested, absence of thirst, appetite, urination, or defecation, those are all, of course, bell ringer signs. Any behavioral changes that you see, cranky today, some of the new science on animal behavior and cognition is really, really interesting. And I hugely encourage you to learn more about the new research on that. There's also a new thing called facial pain recognition in horses. It's called the grimace score. Sadly, it was developed for bunnies when we were doing it with cosmetics in rabbits. But essentially, there's a new score. If you put in facial grimace score plus horses, you'll be able to find that, because it actually starts to teach you to look at the horse's face. And sometimes you look at the horse and you go, I'm not sure if he's Like he just doesn't seem himself. And so there is now research being done on this facial grimace score that you can actually take a look and tabulate things like tightness in the jaw muscles, or the way the nostrils are being held, or the tightness in the lip. And it's sort of like dogs or humans. I mean, everybody knows. How many here have migraines? Your friend know when you're getting a migraine? They can see it in your face? No? Okay, so you're hiding it. But a lot of times, if you know someone has migraines, you can see it coming in your friend's face if you know them, right? Because you can just see it starting to come. And horses do show us those signs too. Okay, so very quickly, you're out there and you take a look at your horse and he ain't doing right. So you pick up your handy-dandy horse health check. And we've got that as a handout there, so you can actually record on this. So a lot of people will take that and they will actually laminate it and put it in the barn and go into the stall and do it, and then put that into your files. So we go out there and we see the eye's a bit glassy. You do the cap refill, it's a bit delayed. You do heart rates, 68 at rest. Do we have a problem? Probably. What's that mean we do? Stop and take a good hard look. So any yellows, one or more yellows, be careful. This time we've been out on a trail ride and it turned really hot and humid over the lunch hour. And now we're seeing skin pinch. And you listen to the gut sounds. So we've got some reds and some yellows. What are you going to do? Okay, we potentially have a problem here. So you need to record this and talk to your vet about it. And I'll tell you a very quick story. Some people think this is a very complicated way of looking at your horse. I can do it in 2 minutes or less and assess a horse, so it doesn't take you very long. And if you think it's hugely complicated, quick little story. We teach this in our online courses. And one of the students in turn taught it to all the students in her riding school. And her daughter one day was looking after the noon hour feeding, went in, and the horse ain't doing right. So she goes to the tack room, picks up the little thing, she goes through the whole thing with the horse, stethoscope, rectal temperature, and everything. And she finds some things that are of concern, calls the vet, Dr. So-and-so, I'm really afraid my horse is in a potentially serious condition. And the vet goes, are your parents there? Can I talk to a parent or an adult? No, there's nobody here but me. Dr. So-and-so, the heart rate is 68, the gut sounds are absent, I have a mucous membrane that's pale and tacky, and the skin pinch is 4 seconds. And he said, I'll be right there. So, long story short, horse had impaction colic, treated the horse, it was fine, but he turned to this young girl and he said, young lady, you just saved that horse's life. Because if that had been ignored for a longer period of time, we all know colics can go south in a real hurry. Right? So it's a very quick little thing. You can learn it very quickly. If you're concerned about any of it, obviously phone your vet. Next time your vet is over looking at your horses, have the vet walk through it with you to show you so that you know that you're doing it right. But it's a very quick way that you can give objective information to the veterinarian when you do that phone call. And it's something we teach for our large animal rescue as well. Because if you've got a horse that's down in a trailer, you can flip up those mucous membranes. You may or may not be able to do heart rate, but skin pinch, mucous membranes, and you can very quickly assess parts of the horse to know whether it's normal or abnormal, and that's your cue to call the vet.